thank our presenting sponsor, West. We can't do what we do without those that support us. And we are most grateful. Look at this wonderful team of corporations that are sponsoring this speaker series. We have Daiichi Sankyo, Merck, Lilly, GSK, and then, of course, our presenting sponsor, West. So a big shout out for them. They make it all possible. We do 36 of these a year.
At least.
You're right.
We're always adding more. Yeah, we're always adding more because the need is there.
Absolutely. When it's hot in the news too, Erin, we always want to be thoughtful and trying to get addressing the topics in real time so that we can give our community the facts and not feel like they're a little bit lost in the confusion. Sometimes there's a disconnect when you're hearing the headline and not quite sure of understanding. So you are right. We do more than 36. Yeah. Beautiful. All right. Well, I think we get started, Erin. What do you say? We have a full schedule.
Sounds great. Love that. Yep.
All right. So tonight we are bringing you this wonderful Potty Talk segment. And this is backed by popular demand. We are actually doing this in Spanish as well. We all know that there's a lot of treatments that are really difficult to adhere to. However, with some tools and some ability to tune in to areas that can actually support you during this time, it could change the overall well-being of how you're able to manage them. And that's what today is all about. Right. So we have two of our speakers today. Before I get into that, though, I want to remind you, we do have an Ask the Experts coming up next week. So please tune in. You could just watch it right on your Facebook Live. We are going to be talking about on Thursday, July the 20th at 12 o'clock. We're going to be talking about palliative care. What's in a name? What is it and what is it not? And there's a lot of confusion around that. There's a lot of confusion around what it feels like to be on palliative care. So we're going to break it down with one of our professional advisors, Cal Cates. They are extraordinary, has been with us for over 10 years. And I hope you all tune in or watch the recording for that. All right, Erin, I think we should bring up our first speaker, which is Sarah. What do you say? All right, there she is. Sarah, thanks for tuning in from Spain. Yeah. Sarah has been with our community for well over 10 years. Sarah, I feel like you're one of our first licensed counselors, helping the Unite for Our community in a whole host of areas, but really specializing in counseling for cancer care. You have quite a community, that you're able to support. And Sarah, I'm going to let you take it from here and share your screen and share how we can really manage some of these side effects and symptoms when it comes to GI issues.
Perfect. Thank you so much, Sue. It's always such an honor and a pleasure to be with you and with our amazing community. It has been a decade that I've been on the provider list, and it's been just the best experience for me. I'm going to talk about how our emotions and digestion kind of co-influence each other and try to come up with some solutions that you can try from the mind part of the mind-body connection and a little bit of the body part of the mind-body connection. So let's see. We're going to talk about how our emotions affect our digestion. Our psychological, I think that one of the things that's really important for us all to remember is that in our culture, we're very much individualistic, and we fail to consider the broader culture and the society that we're living in, whether that's the family, the community, and on and on. So a lot of times we put a lot of burden on ourselves and judge ourselves for things that are not, it's not just us, it's us in connection with other people. So just a plug for the social psychology perspective. We're going to talk about the impact of psychological and social factors and how the fact that influences our motility and digestive function, how we perceive our symptoms, and also can influence behaviors for the better or for the worse. So according to Harvard Health, there are many studies that show that psychological approaches to things like anxiety, depression, and even stress reduction can lead to an improvement in digestive symptoms, with people who are dealing with digestive problems. Another thing is, so that's the top down. Now the belly up, most of our neurochemicals that are affecting our mood and well-being come from our gut. And also pain and discomfort can affect our emotion regulation and our behavior. And I think that it's really important for us to have compassion with ourselves and recognize that when we're not feeling well physically, that can really take a toll on us emotionally. On the molecular level, most serotonin is, and that's the thing that's really known to be linked to depression, is produced in the gut. And there was a study that found that the ways that chemo-induced the gut-brain axis dysregulation affects our digestion, mood, and even our neurological symptoms. So the chemo effects are known to create greater, well, we know that people who are within our community going through treatment have a much greater incidence of depression. And it's not just in your head. It literally can be that the way that these drugs are affecting your gut biome are affecting your neurology and your mood. So be compassionate with yourself is the big lesson of the day. And then let's work to kind of backfill some of the stuff that our treatments might be taking away from us. So I wanted to share with you one simple tool. It's adapted from something else, but it's really effective. We call it breathing into balance, and we do the same thing 2 times. The first time we put our fingers under our collarbones, and the second time we put our knuckles under our collarbones. And it's ridiculously simple. I'll show you the little directions here, and then I'm going to stop sharing the screen. We'll all do it together. And even before we do that, I just want to check in with the group and see, does this make sense to you so far? Like, do you feel like not only the existential crisis, the whole thing could be affecting your mood, and then the other way around, when you're having digestive problems, then you get into this, and the more we hold on to the problem, the bigger it becomes. Like when I think about how much it hurts more. I know that there are physiological reasons why your gut is not behaving the way that it used to, but also the way that we think about it can help it or hurt it. So I just want to make sure that any of that is making sense so far. Does that resonate with you? And then we'll do the breathing into balance. So you're welcome to use the chat. So let's try this little breathing exercise. So a really great, simple way to just calm down. If you're having some extra symptoms from the digestive perspective and you need to calm down and relax yourself so that either things can flow or things can maybe not flow so much. And obviously, of course, there's physical stuff that you'll be talking about with Erin, but from the energy and mind body side. So let's try this. So you cross your hands over your chest, put these 2 index fingers right under your collarbone. And there's a nice important spot here that has to do with anxiety. And we're going to take a full breath in and out. And then we're going to breathe halfway in and hold, all the way in and hold, halfway out and hold, all the way out. And then we'll repeat the whole thing using our knuckles. So you willing to give it a try and see if it doesn't feel calming? I was just sharing this with a group recently and everybody seemed to find the relaxing in it. So let's try it. So breathe in and out. Halfway in and hold. All the way in and hold. Halfway out and hold. And all the way out. And then breathe in and out. We'll do the same thing, but just tuck the fingers under so we touch those spots with our knuckles. And here we go. Breathe in and out. halfway in and hold. All the way in. Halfway out. All the way out. And then in and out. You can release your hands. And if you want to take a moment to share in the chat what that felt like for you, it was pretty simple and quick. But isn't that so interesting how we can really make a difference in, such a short amount of time? So, all right, while you're typing, potentially I'll share more. Oh, let me see what this chat says. It felt relaxing. I'm glad. And about it being in exactly the right spot, our bodies and minds are pretty resilient with us, and they'll give us a break. So it's kind of right under your collarbones, and it's okay if you're off a little bit. No big deal. Wow. So people felt relaxed right away. So, and somebody's asked, what's the difference between this thing that we just did and another thing that I've often done in our meditation groups, which is the simple butterfly hug, where we're just tapping on these alternate points. It's just there are several different tools and techniques that we can use, and I want to share different things at different times. And that breathing exercise we just did was a little more complicated than what I usually felt like I wanted to do in the meditations. So yes, you got to work around the port, and definitely working around the port. I think that ports tend to be a little farther out than where we're supposed to be with our collarbones. I think that my collarbones are actually kind of wider apart than most people's, and my eyebrows are wider apart than most people's. So often when I'm guiding people through these things, I look like I'm farther out to the edges than I'm supposed to be. So, okay, let me reshare my screen. You're welcome, and I'm happy to answer any other questions or clarify things as I chat along. And we can share this content with you guys so you can have access to this. Oh, here's another really cool exercise. This one has been so helpful and powerful. Another really simple thing that you can do if you're really in distress and you need to calm down. The exercise with the breathing that we just did can be really helpful. And here's another one, so simple. We're going to do breath, 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 breath in 4 different places, all while you put one hand, doesn't matter which one, under your belly button, like the guy showing in this picture. And we're going to touch the same points that we just did with the breathing, but only using one hand. So just spanning the collarbones, and then under the nose, under the mouth. And the guy showing us his hand on his low back in that last picture. So I'm going to stop the share. And this is the directions of how to do it again. So that'll be in your file for future reference. So let's try this and feel how so many of you felt very relaxed after the little breathing exercise that we just did. So we're going to try this other one now. And we're just going to quickly go through these series of points, not even 30 seconds, like it said on the slide, just a breath in each place. So see how you feel. One hand on your belly, doesn't matter which one. We're going to touch the collarbone, under the nose, under the mouth, and then you can put the back of your hand at the small of your back, and under your collarbones, under your nose, under your lips, and at the tailbone. And then again here, not even for a full breath, just so quickly moving through these points. And it can really be just gently kind of down regulating your whole energy. We'll do one more round. Just touch, 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 and touch. And so again, if you have any questions or comments, just notice how that feels to just that simple thing touching these different spots, and it really can kind of pull our energy in. These are things that are so simple that when you're in a fight flight response, you can do these different exercises. You know, there's so many out there, and I share different things with you. So Karen, you're yawning. Different ways to tackle the same issue, and when you have many options, you can pick one. You can pick one and just see what you like. So no, you don't have to touch each spot for 30 seconds. The whole thing can take 30 seconds. It's so fast and really, really efficient. And let's pause, take a breath, and just check in with yourself after sitting together for 15 minutes and trying a couple little energy routine exercises and thinking about the mind-body connection. How do you feel? Is it making sense? Do you feel a little bit of a difference? You know, we have that bottom up and top down. These exercises can work for severe pain for sure. And with pain and all physical stuff, the more we're focusing on it, the worse it feels. And if we can think about something else, that in and of itself will help. And the next exercise that I want to show you is the EFT tapping, where you tap on a series of meridian points. This all comes from a blend of Western psychology and Eastern thought. And this particular EFT tapping has been shown time and time again to help people reduce their pain and physical discomfort. And a lot of this was stumbled upon by psychologists, especially people who are working with veterans who had PTSD and also incidentally had pain. And they were tackling the stress, and they found that the pain cleared up. Regarding this thing, I've learned since I first created my slides, and I just didn't edit the slides, but the lady who was telling me about this particular thing said it was just as fast as we did it. I thought originally that it was a slower, more deliberate thing, but upon closer investigation and then further conversation, I learned that it was just that fast. So it can be done slowly with a breath at each spot, but we can also accelerate it so that it's just as quick as we went through together. And this lady who's a colleague found that people did that in this quick succession 6 times, and their pain and other problems was dissipating like really, really quickly. I was surprised that it was that fast. So thank you for asking for that clarification. So let's try just a little intro to the EFT. I'm not going to take too much of your time because I know that there's a lot that we want to talk about from the nutrition side. But another tool that you can use from the mind-body side, the mind part of the mind-body side, that will help get the body a little bit more calm. Certainly there's stuff happening, we know, stuff happening physiologically. But we know that calming ourselves can help ease ourselves up and take the edge off, or even sometimes just put a stop to some of the, for lack of a better way of putting it, stop the madness. I mean, there's probably a better way to put it, but I didn't find it. So this EFT tapping routine is becoming super popular. I don't know how many of you might have heard about it before. It stands for the Emotional Freedom Techniques. It's a brilliant therapeutic tool, but it's also become a little self-help darling. So you can use it both clinically and on your own. And it involves tapping on a series of meridian points while you're thinking about or saying reminder phrases about the problem. So if you're having belly pain or constipation, because of, the principle of this is that there are these energy meridians. And they might have blockages. And just like an acupuncturist would release the blockage with needling, acupressure people would open up the blockages by using pressure on the points. So this is a very westernized version of this brilliant, beautiful, and complicated Eastern science that we don't have to know all the details. We can do this Western approximation of it and get a lot of the same results. And really, it can be so, so powerful. So let's just go through this together. I want to show you how to do the EFT protocol. We'll do just 2 rounds and then see how you feel. So before you start, take a moment right now to rate how comfortable you are. If there's an area in your body that feels uncomfortable. And people really have used this exact technique to get rid of headaches, get rid of constipation, get rid of insomnia, get over diarrhea. Like a lot of these things do have the energy component, in addition to the mental health stuff, the depression, anxiety, stress, all that. And then, so I was asking you about your physical stuff, but also notice how anxious or calm you feel right now, how stressed or relaxed you feel. And so notice that. And then just follow me. We'll do it together. It's not so complicated that you need a big intro first. We're going to start by tapping on the side of your hand. You can go sides of the hands together. Doesn't matter which hand you use. And I like to use the fingers on the side of my hand because I find that otherwise, if I do it like this, my wrists hurt. Now, something weird about how my body is, but whatever's comfortable for you, either side. And while you're tapping on the side of your hand, you say, even though I have this problem, and you name whatever, constipation, or my belly's on fire, or I keep having diarrhea, or I feel out of breath, or I'm so scared, or whatever it is, pick one. I deeply and completely accept myself. And then we'll say it again. Even though I have this problem, and you name what your problem is, I deeply and completely accept myself. Now that's the only point that we touch that we're accepting ourselves. Now we move on to the deep and dirty, just focusing on the problem. So tap on the top of your head. I have this constipation, or keep going to the bathroom. And then the inside corner of your eyebrow. So I was teasing or talking before about how I plucked mine too wide when I was younger. Right by the bridge of your nose, this pain in my belly, whatever your problem is. Then right outside your eyes, close enough that it almost makes your eyes wiggle. This pain in my belly. Under your eyes, this problem, whatever your problem is. Under your nose, this problem. Right under your mouth, this problem. Those collarbone points again, this problem. And the last one is right under your arms, this problem. You can reach around and you can do one side if you want to. And we'll do one more round, top of your head, this problem. The corners of your eyebrows, this problem. The outsides of your eyes, this problem. Under your eyes, this problem. Under your nose, this problem. Under your mouth, this problem. Under your collarbones, this problem. And finally, under your arms, this problem. And then take a breath. And check in with yourself again. Remember how you rated your discomfort or emotional distress before we started. And if you don't mind sharing, if you notice any drop in that. Sorry, right on your bra strap is the under the arm spot. Thank you, Barb, for pointing that out. Sorry, I didn't realize that my name was covering up where I was touching, but it's right under your arm. Oh, My Zoom background made me completely disappear, but it's right under your arm in the bra strap area. And again, our bodies are pretty forgiving, so yeah. Well, just quickly, I wanted to show you one other thing, which is that the meditation practices and all the things that we do that can help us calm down, our yoga, our deep breathing, the EFT that I was just demonstrating, we just did together, that can help us activate our parasympathetic rest and digest nervous system, which can improve digestion. It can strengthen the gut barrier. It can even reduce inflammation. And then eating mindfully and in a relaxed state. And Erin's going to talk about what to eat, but I'll just note how to eat can make a really big difference. So when we sit down to eat those meals that Erin's going to be talking about, take a moment to just relax yourself first. If we're in a clenched, tense space, like, oh gosh, what's going to happen from this? That's probably not going to help the situation. And I wanted to share with you too, when I did this presentation before, we talked about the different emotions that are associated with each of those points that we tap when we're doing our tapping. And I can share that if anybody's interested. I have this slide kind of pulled out into a separate document. A lot of people were interested in that when I did this many months ago. And then the EFT to relieve nausea is one example that I wanted to call out. I was talking about having stomach pain or having constipation, but we've got testimonials of people who have used that technique that we just did to relieve nausea. So those are the things that I have to say. Yes, I can share those slides in the chat for sure. Happy to do it. I'll do that. Yeah. Thank you so much. I could keep jabbering away, but I know that you want to hear about the food side of things. So thank you all for your time and attention. And I'll stick around for a little while. I'll share those resources into the chat.
Yeah, thank you, Sarah. Sarah, as you were doing all these, I was actually thinking like it is so valuable that when you teach us that possibly we do this even when we're not feeling such anxiety and pain, so that we have a routine, like we know what to do. So when the time calls, it's not like, how did I do that? Am I touching the right place? So would you recommend just, do this anytime you can so that you can draw on this tool a little bit more quicker? Does that make sense, Sarah?
Such an important point, and I'm glad you said that, Sue. Yeah, I think I shared 2 or 3 different things that you can do, and I would recommend that you pick 1 or 2 of them and incorporate it into your regular practice, and just use it like do your daily meditation and a little tapping routine, and that will, for one thing, keep the edge off of all this stuff. And for another thing, when you do get distressed, you'll have these tools more readily available, top of mind, well ingrained, just part of your routine. So yeah, great point, Sue. Absolutely. Thanks for saying that.
Yeah, I loved all of them. And I'm hoping those of you that are joining us tonight, you have our email. Send us an email. Let us know if you're trying them, using them. We'd love to hear your feedback. It's so valuable for us. And then, of course, for Sarah, as she continues to give you a host of tools in her toolkit to help you with this stress and anxiety. All right. Thank you, Sarah.
Thank you.
You're going to be going to bed soon, so I know that.
Yes. But I'll get those slides shared before I do.
Good. Thank you. All right, so next up, I have the honor of bringing up Erin Pellegrin, and Erin is no stranger to any of us. She is our Director of Culinary Nutrition here at Unite for Her, has been on our staff for well over 8 years, I want to say, and then actually taking a full-time position probably 6 years ago, I think, Erin, right? And leading a dietitian team of 4 now. So Erin, I'm glad you're joining us again. We have so much valuable information to share on this topic. And I am glad you are leading the way. So I will let you take it from here.
Oh, thank you. And it's so nice to follow Sarah. And I think the connection between our gut and our brain, and then our actual food choices and how we prepare our food are so closely related. So it makes sense to have this discussion together. And just like Sarah talked through her presentation and wanted to hear a little bit about your own experiences and how you're feeling, I will be following the same during my presentation. So I'll be taking some moments to pause and perhaps do a little bit of sharing again of what worked for all of you, what haven't, what did you try on your own. I think sometimes when it comes to digestive health, we know science, we know as dietitians what we can recommend, but there's some anecdotal experience that's also worth sharing and trying. So that's where all of you come in. So with that, I want to share my screen and I will take us through a little bit about Potty Talk. So that looks good?
Yep. Okay. Great.
Wonderful. So today, again, I'll be talking about the nutritional aspect of our GI health and going over the impact that cancer treatment in general can have on overall digestion, and then how we can sort of focus on nutritional management, but not forgetting about that brain-gut relationship as well. So we do know that cancer treatment and especially chemotherapy can affect upper GI side effects and functioning, but it can also affect lower GI effects and functioning. I will be focusing a little bit more on lower GI this evening, but know that, you know, there's so much more to this discussion and only so much we can fit in this time, but hopefully you will take some learning with you. Okay. So the first thing I'd like to point out is, again, because all of you and you know, each person going through cancer treatment is unique and your body is unique to yourself. It's important to remember, and this is something I often bring up in our nutrition consults or whenever I'm talking with our members, is that, you know, what causes a particular side effect for one individual, it's never a guarantee to have that same effect on someone else. And while sharing your experiences with others can be very helpful, I always also throw out the caveat that it's never a guarantee. Sometimes that anticipation of what may come because of what we read or what we heard or what we think may experience is enough to provoke some of that anxiety and distress. But I really think it's worth just reminding that, remember, just because someone experienced one thing doesn't mean you're going to follow the same suit. And that is a little bit reassuring. So, you know, cancer treatment in general has an effect on the total body from head to toe. We will be, of course, focusing more on that digestive distress. But it really can have an impact from top to bottom. And of course, you know, we're talking a lot about medications and infusions and chemo, but we know that there are other aspects of cancer treatment that can affect our overall body, that can affect our GI tract, our digestion. Surgery can have an impact on it, the anesthesia, the pain meds. If you're having surgery to the pelvic or abdominal area, that can make an impact. If you are receiving radiation enteritis, which is a functional disorder of the large and the small bowel that happens during or after a course of radiation to the abdomen, pelvic, or the rectum. So that can have an impact on GI distress as well. So it's important to note that there's lots of different variables that could potentially affect our digestion. So thinking about medications, and when we think of chemotherapies, immunotherapies, you know, here is a list as a dietitian that we sort of keep handy, that we know the usual suspects, right? When we hear these medications, we know an individual may be experiencing GI distress. Let's make sure we ask them about it. So these are, again, sort of what we anticipate to have some sort of impact, But again, going back to that initial slide, it's never a guarantee. And of course, there is a long list. This is not all inclusive, but there is a list of other medications that could be part of your cancer treatment that could have an impact that is not included on this slide. Things like opioids and pain medications are notorious for causing constipation. Medications that for anxiety or depression can also have an impact on our GI tract. Things like antacids or diuretics, certain supplements like iron, which can be completely appropriate, but known to be constipating. Sometimes sleep medications. And again, going back to that point on surgery, anesthesia. So it's important to know that we see these medications, but we also want to be thinking outside of the box of what may be contributing to our GI distress. So jumping into the first part of this, let's talk a little bit more first about constipation, which can be particularly challenging for someone because of that sort of trickle down effect it can have on the body, on our appetite, on how we feel, on our desire to want to have food. So what constitutes constipation? So it would be a shift from having just a regular bowel movement, so what we know to be sort of normal, it might be smaller, the consistency might be harder. If you are not having regular bowel movements for 3 days at least, if you are passing liquid stool, change in consistency, if you are noticing a stomach ache or having that cramping, right? And it doesn't get better or it doesn't go away. If you're having large amounts of abdominal distension or gas bloating, if you feel like you're belching more, if you're seeing that abdominal distension, that swollen belly or that enlarged belly, one of the comments that we may hear, I look like I'm pregnant. I have this distended abdomen. A lot of times, we'll get into the conversation of, let's talk about your bowel movements. How regular are you? And then, of course, in more significant cases, nausea, vomiting. So think about it. If your food and your digestion and your GI tract are not moving down the line in a regular fashion and sort of backing up, then that sort of backup can cause the feeling of nausea. And that's one of the questions that I often ask. If a person is saying, I'm having nausea, I'm having more indigestion, I'll say, are you constipated? Because a lot of times that side effect will be relieved when we can get your bowel habits under control. So there's certain times, and I think it's worth noting, when do you call your doctor? Because if this is something that you are experiencing, it's fine just for a period of time to sort of take things in your own hands, but there is an appropriate time that you want to let your physician, your medical team know, so that we avoid a more significant, a more severe scenario. So if you have not had a bowel movement in 3 days, you want to let your physician know. If you are noticing things like blood and stool, or when you're wiping with your tissue, worth noting. If you are having a lot of rectal pain, if you are taking a prescribed laxative and you are still seeing no improvement in that, please call your physician. Again, that nausea, vomiting, that side effect typically comes along when constipation has been going on for a period of time. So if you start experiencing those side effects, maybe nothing else has changed in your medication or your treatment regimen, that maybe we couldn't put the puzzle pieces together to say, okay, this other thing may be causing it, worth telling your physician. And then again, if you are having abdominal pain, cramping, swelling, it's not getting better, let your physician know. And it's really important because, which we'll get into, there are pharmacology tools that your team can give you. Sometimes we just need a little bit of extra help. But first, we will start with nutritional interventions. So the first bullet here, and one I think is so important, is the importance, for lack of a better word, of establishing a bowel regimen. So a bowel regimen is your regular habits of going to the bathroom every day. And our GI tract often works on a regular schedule. So if anyone has ever traveled, and when you are in a different place, you are around different people, you are not in your comfort zone, right, of having the things at home that you normally do. All of that shifting from the norm can impact our regularity, our urge, our feeling to go to the bathroom. So some things we can't control, like traveling and leaving our home, but one thing we can do in our comfort zone, in our home, in our personal bathroom, is allow our bodies to get on a regimen. A lot of times what that may look like is a person gets up, maybe they have some water, they urinate, they brush their teeth, they make coffee, they have a little snack, they go to the bathroom, right? And so we're sort of training our body to get on a schedule. And so when you're sort of working through this, trying to fall into a pattern can be really, really helpful. Now, along with that, and what can be a good accompaniment is making sure nutritionally we are getting enough fiber every day. So the daily goal for an adult woman is 25 grams of fiber per day. And for men, it's 38 grams of fiber per day. This may seem like a lot, and unfortunately, most Americans are not meeting our fiber needs. So any incremental increase that you can add is a benefit. Where do we get fiber from? All of our plant foods. So anytime you can increase your plant food intake, fruits and vegetables, your whole grains, your beans and lentils, your nuts and seeds, anytime you can add those in, you are upping your fiber intake. Now, I will say that if this is something that a goal that you are trying to work towards, please do not go from 5 grams of fiber a day to 25 grams of fiber a day. This is something that you want to take slow and you want to take in time, because we want our healthy bacteria to get used to breaking down that fiber. And that just takes a little bit of time, because if we make too big of a leap, what tends to happen? We experience quite a bit of abdominal distension, a little bit more gas, it's uncomfortable. And then we start to assume that my body can't break this down. There's something wrong with me. I can't digest this. And that is not the case at all. So to ease those natural side effects, take small fiber increases, give yourself a week, 10 days to allow your GI tract to adjust. And then we go up from there. So small increments are the way to go. Now, insoluble fiber, particularly in the discussion of constipation, is really important. So insoluble fiber does not break down in water, which means it moves through the GI tract pretty much intact, right? It's we often think of insoluble fiber as that roughage that's in our diet, but it's also found in foods like bran, flaxseed, wheat germ, inulin, which is a type of prebiotic, which prebiotic is the food that fuels our healthy bacteria. So incorporating foods that have that insoluble fiber will really promote regularity and going to the bathroom. And again, we have things like fiber supplements that if you are really struggling to increase your fiber intake, or if your appetite is compromised for some very good reasons, this is a convenience that you can add for a period of time to help up your fiber intake. A fiber supplement is most helpful when your constipation is not caused by pain medications, okay? So when it's related to another type of medication or a treatment regimen that you are on, a fiber supplement will be beneficial. If it is from opioids that you're using, more often than not, we may have to go to the next level to help move things along, but I'll get there. Now, in order for fiber and a bowel regimen to be really, really successful, we need to make sure that we are hydrating. right? So a goal, 60 to 80 fluid ounces for an average adult is a great place to start. We know there are certain situations where a person's hydration needs might be a little bit elevated. If you are working with a dietitian in your oncology center, of course, you can connect with our team and we can go through that with you. But generally speaking, starting with 60 to 80 ounces a day is a great place to start. And your water intake, your fluid intake can come from a lot of different areas. So of course, regular water is our best hydrator, but that can include our fruits and vegetables, especially those that have a higher water content. It can come from things like broth. If you like sipping on a vegetable broth, that adds to hydration. Our teas, even our coffee, even though there's some caffeine in it, it has a slight diuretic effect. But I'm not worried unless you're drinking a pot of coffee or 2 pots of coffee a day. I'm not worried that that is dehydrating you. I see that as adding to our hydration. One recommendation that I love to offer, especially for those struggling with constipation, is especially in the morning, having warm beverages. Those warm beverages can help to stimulate things to get them moving forward. And a tried and true tip that I often used when I worked in clinical oncology and what our oncology nurses often turn to is prune juice. And our nurses would often even warm that prune juice a little bit, and you would be surprised how helpful that was. So prune juice is really high in sorbitol. Sorbitol is a sugar alcohol, and anytime we ingest sorbitol or sugar alcohols in high doses, it has a stimulant, it has a laxative effect. So it's natural in prune juice. You could also try other nectars, apple, peach, pear, to see if that works for you. That's sort of hit or miss, but you've got some options. And then finally, really helping to establish good, healthy gut microbiome, looking at probiotics that are naturally found in food, fermented foods that have live active cultures, incorporating them naturally. You don't need to start bringing them in any large quantities, but making a choice of having a fermented food each day is a good option. Moving ahead to pharmacology, because again, especially with constipation, we may need to take it to the next level or have a little bit of additional assistance with our nutritional shifts that we are making as well. So your first thing that you could try is a stool softener. Colace, most common if you need it. This is not a laxative. It does not have a laxative effect. It does exactly what the name says. It helps to soften our stool, which helps us move it along and makes it less painful. Now, a lot of our members or patients may be familiar with osmotic laxatives. So these draw water into the colon. So you're looking at things like Miralax, which I find to be particularly helpful in certain situations for patients. You could try milk of magnesia, magnesium citrate. So all of those could help because they draw water in and they help to flush everything out. Under the direction of your physician, you could certainly start something like a stimulant laxative. This stimulates peristalsis. So peristalsis is the natural contraction through your GI tract that moves things along. So it starts in the stomach, small intestine, goes all the way through and helps us excrete when we go to the bathroom. So these sort of things, Dulcolax, X-Lax, Senecot, stimulate that contraction. It can also be why certain medications in this category can cause a little bit of cramping and abdominal pain because it's stimulating that motion. And if we're really backed up, that can be a little bit uncomfortable for a period of time. Now, for those that may be on opioids, again, pain medications, we're likely using something like a laxative with a stool softener to help move things along. And then finally, in really severe cases, you could use a prescription to help you go, something like a Relistor or an Amitesia. That would be under the direction of your physician and definitely a last case scenario. So I want to just share, and I realize our time is sort of limited, and Sue, perhaps we can leave this for the end where we can do some sharing together so I can get through the rest of our slides. Maybe we'll move ahead in that regard.
Yeah, I like that idea, Erin. Erin, there was
Okay,
one question though from Monica,
sure.
and she just wanted to know if cherry juice was also something that might move along stools.
Absolutely. So you could try that as well. Some tart cherry juice, any of those sort of concentrated juices. Absolutely. Yeah, I love that. Thank you for sharing. So think about, just like Monica suggested, what's worked for you. We'll have a few minutes at the end to sort of share what you've tried, and we'll all be keeping notes, and hopefully this will serve others. So let's move to the other end of the spectrum. So now we've got diarrhea. Okay, so diarrhea, what constitutes diarrhea, and when we can start thinking about, oh, I'm really distressing over this. We're having 3+ bowel movements a day. It's changing in that consistency, right? It's becoming less formed, more liquidy. It's considered chronic diarrhea if this side effect persists for more than 4 weeks. And if you are experiencing this for that long period of time, I do hope you are letting your physician team know, because as you can see, it can lead to a lot of different problems. Dehydration, especially in the summer months with diarrhea, dehydration happens so quickly that it's very, very important to make sure that you are replacing those fluids and those electrolytes, because we will lose a lot of sodium and potassium when we have that chronic fluid loss, which is essentially what's happening. Unintentional weight loss, because things are moving through the GI tract so quickly, our body is not able to keep up with absorbing those nutrients. Plus, inflammation that could be taking place that's lining the GI tract also affects how well our small intestine can absorb those different nutrients. Overall fatigue, it's exhausting to run to the bathroom and then lay down. And when we're dehydrated, that contributes to fatigue. And we want to do everything that we can to minimize your fatigue. I mentioned nutrient insufficiency and deficiency. So again, it really impacts how well our digestive system absorbs not only micronutrients, but macronutrients. Long-term down the line, we're looking at possible risk of malnutrition, skin irritation, right? We're constantly in the bathroom, we're constantly wiping, it's painful. So there's lots of side effects, and we want to make sure that we are minimizing this risk. A couple other things I just wanted to note is that, especially with diarrhea, we want to think about, especially if you need assistance with getting to the bathroom or mobility at home, if you have a caregiver or someone that is assisting you or helping with your care, that can also be an increased stressor on them as well. So let's talk a little bit about nutritional interventions. And here, nutrition can make quite an impact on helping to at least ease some of the diarrhea that we are experiencing. So the first thing that you want to think about if you are having diarrhea is changing the size of your meals and moving away from feeling like you need to have a big formal meal, breakfast, lunch, dinner, to smaller, more frequent meals, smaller volumes of food. Even if it's a few spoonfuls, a quarter cup serving, a few forkfuls, that's perfectly fine. More often than not, smaller volumes of food, smaller serving size, will be better tolerated by your GI tract. Cooking methods are also really important. So when we talked about constipation, we talked about insoluble fiber. We talked about roughage, right? That fiber can help your body move things along. Well, we want to do the opposite when we're thinking of diarrhea. So instead of having things like your raw fruits and vegetables, things that are higher in soluble fiber, when we think of our produce, I often say cook your vegetables, have cooked fruit, because the cooking, the softening of that fiber is much more easily tolerated and digested by the GI tract versus something that's really rough and raw. So you want to make sure that you are throwing your veggies in a soup or stew, Can you saute them really well? Can you steam them really well? So thinking to those more cooked methods versus raw. Again, hydration, very, very, very important. The quickness at which dehydration can occur and can make you feel terrible happens, I think, way sooner than many people anticipate. So again, going back to that 60 to 80 ounces a day. And for every loose bowel movement, if you can add 8 ounces of hydration to that, sometimes we have to use an oral rehydration solution to get some more sodium and potassium. Then you may have to do that as well. So again, sort of doing a little bit of math in your head of upping your hydration volume, depending on how often you're visiting the bathroom. Shooting over to fiber, again, we're kind of leaning more towards number one, a low fat. So higher fat foods, number one, will sit in the belly longer, but that can also be aggravating of diarrhea. So you really want to go the low fat route, and then low insoluble fiber, low lactose. So one thing worth noting is that even on a daily basis, on a regular, when you're feeling fine, if you can tolerate dairy, sometimes what happens when there's chronic diarrhea, when there's inflammation of the GI tract, lactose becomes more difficult to digest and absorb. So during this situation, I usually say avoid lactose for the time being. And then once things become a little bit more baseline, you can slowly reintroduce that. But we do know that that can be an aggravator. And then we're going to increase our soluble fiber. So things that have pectin, things that can congeal, that can help to thicken. The notorious brat diet, it really can be helpful. So applesauce, bananas, oatmeal, potatoes, rice are all good sources of soluble fiber that can help to solidify, to bring things together. And then psyllium, which is a form of fiber that is in Metamucil and Citrusel, that is high in soluble fiber as well. So if you want to try adding a little bit of that in to help to see if that helps as well, you can give that a go also. Other foods that you may want to be mindful of, so you want to limit gas-forming foods so that you do not cause additional GI upset. Cruciferous vegetables, some legumes, they are notorious for being gas-producing naturally, and that's okay. But we want to limit them when we're having this type of particular GI distress. Avoiding straws and chewing gum because we tend to take in more air, and that can be aggravating as well. And then stimulants, things like caffeine, alcohol, spicy foods that can stimulate our GI tract. We're obviously not trying to cause that. So you want to be mindful of how much of those foods that you're having. I mentioned sorbitol and sugar alcohols, talking about prune juice and constipation. In this scenario, we want to make sure that we are avoiding it because of that diarrhea effect that high contents or high quantities of sugar alcohols can have. And then certain probiotics may be beneficial in helping digestion. So if you are taking a probiotic, or you want to speak with your physician, there is some data behind these particular strains of bacteria that may be helpful in reducing diarrhea. Okay, moving ahead to pharmacology that may be appropriate. So first line of pharmacology are what I think most of us think of. So Imodium, Lomotil, that can help to stop diarrhea if all of these other methods are not really making an impact. So definitely talking to your physician first before you start any of them. Taken to the next level, opioid, so a tincture of opium. This is really in unique scenarios and in very significant cases. I have only ever had patients prescribed a tincture of opium when I was in a clinical setting for a patient that was admitted in the hospital. So this is not something that is relied on quite often. But it's an option if needed. There are certain anti-inflammatory, other over-the-counter antidiarrheal medications that you could try, Pepto-Bismol, kaopectate, so talk to your physician about trying those. And then for those that may be having diarrhea as a result of not being able to absorb foods and fat in particular, a medication, a bile acid sequestrant, Questran, may be appropriate. But again, this is worth a conversation with your physician to see if you are appropriate. So So before we get to what's worked for you and a little bit of sharing in this time that we have at the end, again, just like what we started and what a person may anticipate in their cancer regimen, we also know that what works for one individual and what has helped them may not work for everyone. But I love this idea of giving it a try, right? We're going to try, we're going to see what's worked. And this is where you come into play and our members come into play. And I know me personally, as I talk with our members and I learn, I am often keeping notes and sharing with others. Hey, I talked to someone and this is what she tried. Here's an option for you. Or this worked for this individual. She reported it. Why don't you give this a try? So I think there's so much to be said for, again, a little bit of anecdotal help in helping the overall community. So with that, I will stop sharing the screen to take some questions and even some tips and some things to try for those that may be experiencing. Yep.
Yeah, we had a little bit in the chat going on. One of them is just about hydration. So Monica was asking about Gatorade and just trying to understand if that's a good option, or are there other products out there that you would recommend that might be better?
Yeah, that's a great question, Monica. So when we talk about rehydrating, again, the first and foremost, water is our best rehydrator, but it's obviously lacking in electrolytes. So number one, we could be replacing those electrolytes with food that we are eating. And when we have fluid losses, whether it's sweat, whether it's through diarrhea, the primary electrolyte that we are losing is sodium, because it is an extracellular electrolyte, which means it lives outside the cell in the fluid that is surrounding it. We do lose a little bit of potassium, but primarily we're losing a lot of sodium. So if you know that you can add a little extra salt to the food that you're eating, if you have a good appetite, you in theory could rehydrate with water and then get your electrolytes from your food. Now, you could also lean into other rehydrators as well. You could certainly try Gatorade. Here's the problem with Gatorade is that it's higher, right? Or Powerades, they are really great for athletes, right? And athletes that are exercising for a long period of time, because they contain sugar that helps to fuel their muscles as they are performing. And so if you are not an athlete that's burning through glucose and sugar and, is then using what's in that liquid for energy, sometimes concentrated sweets like that can be an aggravator of diarrhea. So what you could do is find a sugar-free version, or there's lots of other options that are out there, like a liquid IV that has those electrolytes with all of that added sugar. So you've got some options there. So yeah, I mean, if Gatorade is your only option and you're really struggling, you could certainly try that, or Powerade. But again, if you're having it in high quantities, I would just be mindful and do maybe a little bit of journaling if down the line it's not causing a little bit of diarrhea for you. Yeah, but liquid IV can be really helpful for sure. Yeah, you can mix that into your water, Charlene. Yep.
Now, Erin, I remember I swore you did some recipes on making your own Gatorade. Isn't that true?
Absolutely. Yes. So we do have a recipe that's on our blog, because you can prepare this on your own. So it does use a little bit of coconut water, which is very, very high in potassium. Use a little bit of fruit juice. You can add some regular water, and then you're adding some salt into that to replenish the sodium that you are losing. So we can post that link to the blog. I can do a quick search on the Unite for Her blog for that recipe, but that's certainly something that you could try at home, and then you can sort of tweak the flavoring of that a little bit. And then we know anytime we're mixing those ingredients ourselves, we are controlling the quality of what we're consuming. Absolutely.
Right. Mary Jane was asking if there's any tips for someone who is laxative dependent.
Oh, Mary Jane, this is a really great question. And this is the problem. I don't want to say problem, but this is a potential consequence when the body starts to become reliant on laxatives, which I understand, right? Because we want to go to the bathroom. So here is what I would suggest, is slowly trying to wean yourself off of it. So number one, you want to try to establish that bowel regimen at home. So follow that routine. Make sure that you are incorporating fiber regularly. And I will tell you, and based on my experience, personally, professionally, talking with our members and patients in a clinical setting, incorporating things like bran and wheat germ for breakfast, so a high bran cereal, is a wonderful way to start to stimulate going to the bathroom in the morning. So I would recommend bringing those foods into your breakfast to start your day. So incorporating that type of insoluble fiber, establishing a bowel regimen, making sure you're hydrating, and weaning off of laxatives. It is a slow process because your GI tract will start to rely on them, but it is not impossible to come off of it. It takes time. You have to make sure these other variables are happening at the same time, but just be patient.
Great.
It's a great question.
Yeah, it really is. How
Yep.
about vitamin B? Does that cause GI issues? Have you heard that?
B12? No, not typically. So if you are taking B12 in a normal recommended quantity on a day-to-day basis, you should be just fine. With any sort of supplementation, if you are overloading, of course, it may have an increased risk for causing GI distress, but in most normal quantities, it does not.
Okay.
Great question.
And then Lynn had just shared, that she's tried unsweetened dried fruits and like prunes
Yes.
and cranberries,
Absolutely.
Great.
Absolutely. And adding things like that, right? So if you have a bran cereal, you have some wheat germ, or, control that sweetness, add those unsweetened dried fruits to it, add a little bit of fresh fruit. You are just adding wholesome food that has those gut supporting properties and nutrients. And if you can, again, make, it's not a one and done and have this as cereal one day and hope that you're going to see a big difference. It is make it part of your routine.
Okay. Now Barb has been told to go on a low fiber diet to keep her BM soft and small. She has
Yes.
2 questions to avoid some kind of bowel obstruction. So she has 2 questions. How long does it take for the food I eat to finish the digestive process? Trying to keep a diary.
Yep.
And then
What do you recommend?
For a supplement for my nutritional needs?
So Barb, right. So especially with our ovarian members, and when you are having surgery in the pelvic area, right, bowel obstruction, unfortunately, is not uncommon. So what can we do to prevent that risk? So food typically moves through the entirety of the GI tract in 3 to 4 hours. That is assuming you do not have issues with motility. So there is nothing that's slowing you down. So if you know that motility wise, you're fine, typically food moves through at most about 4 hours. And what do you recommend to help supplement my nutritional needs? I am not sure what you mean by that question. Are you talking about like a protein supplement or additional, or are you talking about like a vitamin or a mineral supplement?
Well, can I speak?
Yeah,
absolutely. Yeah, please do.
I stopped eating I was on a lot of fiber, just naturally, fruits, vegetables, and now I've had to cut way back on that. Yep. And I'm worried I'm going to have bad nutrition because I'm not getting a variety of vitamins and minerals. And I've been told, well, take this oral supplement, all sorts of people have recommendations for me, and it's really confusing. Is a vitamin pill enough, or what would you recommend?
Right. So 2 things come to mind. So of course, I think initiating a multivitamin overall is a pretty safe addition to ensure that you are getting a wide variety of at least some nutrients. Usually pretty safe. You don't need to go mega super anything. So if you wanted to, and you wanted to start an adult multivitamin, given your limited food choices, I think that would be fine. Anything more than that, it would need to be warranted from your physician. So you'd want to check levels, right? Have a B vitamin panel done. check your vitamin D, check your other electrolytes. And then you can determine, do those numbers need to come up? Are you deficient? And all right, what are we going to take to bring those numbers up? When are we going to retest? And then when are we going to normalize? So I think anything more than a daily multivitamin, it would be on a need-based, and we'd want to do a little bit of lab work outside of that. And also with bowel obstruction, I'm sure you have tried this, Barb, but also, again, playing with different cooking methods or smoothies or breaking food down. Also understand portions are typically your friend as well. So even if you just have smaller quantities instead of larger volumes of food to help with digestion, those also are other tactics that you can try that can help reduce risk of a bowel obstruction.
Great. Thank you, Erin. And Barb, you can email Erin anytime, right?
Absolutely.
Pellegrin at
Absolutely.
UnitedHeart.org.
Yep.
Okay. How do you balance adding sodium for rehydration when you're also told to reduce salt for high blood pressure?
Great question. Love this. So you have to determine that you are losing a lot of sodium. So here's what I would do. If you are having diarrhea, so you're losing a lot of fluids, I would rely on sodium that is naturally in food, maybe using a little bit of a rehydration solution as opposed to adding a lot of salt on top of your foods already. And that can help to be a little bit of a middle ground. A little bit of a safety net, because of course, if you have high blood pressure, we want to always think about protecting your heart. And so I would start there. Those are two safe measures. So different foods, remember, sodium occurs naturally in a lot of different foods, so rely on that. And then rehydration solution that's naturally occurring. And then if you are having a sodium panel or a basic comprehensive panel, will include your sodium and then find out where you are in terms of, is your sodium low? Is it high? And the other thing is, when we look at lab levels for sodium, if your sodium is low, it doesn't doesn't necessarily mean you are deficient in sodium. It could potentially, but it can also be a fluid overload. So if you think about a glass of water and I put a bunch of sodium in it, I have a certain amount of sodium in here. It's a particular number. The more fluid I add to it, the less concentrated that sodium is. Our blood is the same way, right? So when you look at those lab levels, if you see a low sodium, it doesn't necessarily mean you are deficient in it. There could be a fluid balance issue as well. So another reason to talk to your physician and your medical team.
Great. Thank you, Erin. A couple tips in there from Linda McNabb saying, Trader Joe's A+.
Love.
Can exercise
Absolutely.
bowel regularity?
Absolutely. Lynn, absolutely. So movement, we know that sitting around and being immobile can contribute, I don't want to say cause, but it certainly doesn't help constipation. So getting up and moving around. I also had a gastroenterologist when I used to work at a hospital in Philadelphia. Gastroenterologist I worked with also talked about doing a little bit of gentle massage to the left side, because the way that your colon runs, so your ascending colon comes up your right side, transverse goes across, descending goes down your left, and then it goes out when we go to the bathroom. So a little bit of gentle massage or laying on your left side on a little pillow can help to move things as well. So nothing high pressure, you're not pushing really heavy, but just some light, gentle massage, even down into like your left hip pelvis area. That's sort of where your sigmoid colon goes out. So a little bit of self-soothing massage can be helpful as well.
Awesome. Tracy was asking if baking soda to water, is that good in adding sodium rehydration? Is adding baking soda to water good for adding sodium hydrate?
I'm not sure. It wouldn't be my first go-to. It would change the pH of the water. So it would up the pH, it would make it more alkaline, but I don't know that it would be the best for sodium rehydration. It wouldn't be my first go-to.
Okay,
Great question.
yeah. Barbara was saying she's had several bowel issues that seem contradictory. I have very low appetite and must force myself to eat. I also have severe bowel pain.
Mhm.
Often after eating. At the same time, I'm trying to stay regular with bowel movements. Balancing all of this is sometimes overwhelming. It is so
Absolutely. Absolutely. It's overwhelming. Of course it is. And, there's something to be said when you are eating and you're experiencing pain, it makes us not want to eat, right? Because we know that inevitably we're going to feel discomfort. So yes, it is overwhelming. So Barbara, reminder always, be gentle with yourself. Maybe bringing in some of those practices and those techniques that Sarah mentioned, maybe at the beginning of eating to try to really relax our GI tract can be helpful. So maybe we're building that into our routine. And I would imagine that, a lot that pain that you're experiencing, that discomfort, especially with eating, remember when we eat, our brain starts to initiate peristalsis, that movement. And when we're constipated, that can feel uncomfortable. So, right. So you have a lot going on. So be gentle with yourself. I think those techniques, those breathing, those relaxation techniques before mealtime can ease some of that anticipatory stress that I think any of us would experience. Having that, having that same issue, of course. So just be gentle with yourself, be patient. And as with anything, some days this is all going to work for you, and some days it's not. And that doesn't mean that on the days that it's not working for you, and maybe you're just having a particularly challenging day, it doesn't mean that you did something wrong. It doesn't mean that you didn't follow the plan. It just means that today is just a different day. And for whatever reason, it's just not working, and you're going to do the best that you can on that day. And then you'll try again tomorrow. That's just sort of par for the course. And again, it doesn't mean that you did anything bad or wrong, or it could have anything to do with what you did at all.
Yeah. Anik was saying that when you have diarrhea immediately after eating, what meal is coming out? An earlier one, or do you
Yes.
definitely so quickly?
Yes.
Something
Your GI tract is so long. The length of your small intestine alone, that path is very, very long. So again, when we start eating and we start to put something to our mouth, eating, drinking, our body anticipates digestion and getting ready, moving. It initiates peristalsis. So when you are having diarrhea shortly after eating, it's because that process is triggered. So likely what you are excreting is something that you ate several hours before. Great question. I'm taking Verzenio. Yeah.
All right. So just Tracy was saying, thanks. My husband thinks that it's good for electrolytes. I do not necessarily agree. So she was just having some conversation there.
Yeah.
Yeah. Once you experience constipation, is it more likely to return, Erin?
I guess it depends on the reason, right? Any of us could be constipated. It could be emotional outside of this whole scope of Unite for Her. I mean, constipation could be emotionally driven. It could be a particular medication. It could be because of lots of different things. So, I mean, I guess it would have to be, because of, it would depend on the reason in which it is being caused. So it's really hard to answer that question. Yeah, I mean, outside of this conversation and cancer care, some of us tend to lean one way or the other. There could be something like an IBS situation going on where we might feel like we're a little more constipated, or we have a little bit more diarrhea. That could just be the way that your body moves a little bit. But, it's never a guarantee. In addition, remember our relationship with hormones has a huge role to play with our GI tract. So just the shift of hormones that comes along with this whole process, and oftentimes the dramatic drop in estrogen that we have can greatly affect how our GI tract works. So there are so many facets to this discussion. It's a really complex topic.
Yeah. Well, I feel like we got through all of them, Erin. I think next time we just have a Q&A on all the
Yeah.
nutrition questions, because I feel like they're so valuable. You're amazing, Erin. You give such thoughtful answers. We so appreciate that. Please know that Erin and the team, they do 48 live cooking demos a year. Please join. When you join those webinars, you have access to 2 registered dietitians at the same time. You can actually chat with and have these questions. And, it might not even be something that you're interested in making, but the fact that you're talking about these different ingredients and you have the ear of our team can really be valuable. So, Erin, thank you so much. I think we're going to end up closing this episode out now. And it was really good. Really
It was great. And I love the idea, Sue, and I'd like to say we'll come back to that, of doing maybe an Ask the Experts questions, nutrition and gut health, and just gathering all of more questions from our greater members. We could probably talk for 5 hours about that and answer those questions. I think we get that on the calendar.
Yeah. And I love that Sarah brings this whole body mind approach, because we know how the mind plays on physical symptoms. It is so valuable. So do a little practicing. You all felt really good when you were doing some of these tools. They're different, right? Like they're not in our wheelhouse. Practice them and make them in your wheelhouse so you can really call on them if you need them. And we would love to hear your feedback, so we are understanding what is working and what may not be working.
Yeah, absolutely. And just like she said, start to make that part of your routine now and make it part of your day to day. And then you have something to call on when you need it.